The 7-site Skinfold assessment consists of measurements from the triceps, subscapular, suprailiac, chest pectoral, abdominal, mid-axillary, and thigh. All measurements should be taken on the right side of the body. Mark each site with a pen or marker and pinch either below or above the mark. When pinching a site, make sure to separate the muscle from the fat. The caliper should be placed directly on the skin surface 1 centimeter away from the thumb and finger, perpendicular to the skin fold, and halfway between the crest and the base of the fold. The evaluator should wait 1 to 2 seconds before reading the caliper. Record how many millimeters you have measured and rotate around each site to get multiple measurements. Now that we've discussed the procedures, we will now talk about each specific site. The tricep is a vertical fold on the posterior midline of the upper arm, halfway between the acromion and the olecranon processes. The arm should be held freely to the side of the body. The mid-axillary is a vertical fold on the mid-axillary line at the level of the xiphoid process of the sternum. Have your subject stretch his arm out to the right side in order to make it easier to access. The thigh is a vertical fold on the anterior midline of the thigh, midway between the proximal border of the patella and the inguinal crease. Have your client step on your foot in order to relax the thigh muscle so it can be easier to pinch. The abdominal site is a vertical fold 2 centimeters to the right side of the umbilicus. The suprailiac is a diagonal fold in line with the natural angle of the iliac crest, taken in the anterior axillary line immediately superior to the iliac crest. You can have your client raise his right arm to the right side in order to have easier access. For the subscapular site, have your client put his right arm behind his back in order for you to palpate 1 to 2 centimeters below the inferior angle of the scapula. Once you have found it, have your client move his arm back to his side. The fold will be made in a diagonal direction, preferably in a 45-degree angle. Lastly, for the chest/pectoral site, it will also be a diagonal fold. For men, it will be located 1/2 the distance between the anterior axillary line and the nipple. For women, it will be located 1/3 of the distance between the anterior axillary line and the nipple. Once you have rotated throughout each site and have recorded at least 2 measurements for each one, use the 7-site formula for either men or women, depending on your client, in order to calculate his or her body fat percentage. Go ahead and retest the site if both measurements are not within 1 to 2 millimeters from each other. Once you have calculated your client's body fat percentage, go ahead and look at the body composition table. There is one for either men or women depending on your client. By using your client's age range, you can now identify which category and percentile he or she falls under.